you're washing your vagina the same way you wash your skin, you might actually be harming it. As a pharmacist, I see this mistake cause infections, irritation, and discomforts far too often. Today, I'm going to show you exactly what to wash, what not to wash, and how to keep your intimate areas safely. Before we talk about hygiene, we need to talk about body awareness. Many women were never taught the difference between the vagina and the vulva, and that confusion leads to unnecessary problems. There is no shame here. Understanding your body is a form of self-care. This is where most women unknowingly go wrong. Let's start with the vagina. The vagina is an internal canal. It is not visible from the outside. And here is the most important thing to know. The vagina is self-cleaning. It maintains its own healthy pH and good bacteria that protect you from infections. So when you wash inside the vagina with soap, water, or products, you disrupt that balance. This next part is one of the misunderstood facts about women's health. Now, let's talk about the vulva. The vulva is the external area, including the labia, the clitoris, and the vaginal opening. This area does need general cleaning because it comes in contact with sweat, urine, discharge, and menstrual blood. So, remember this rule: the vagina cleans itself and the vulva needs general care. The vagina has several important functions. It protects against infections, allows menstrual flow, plays a role in sexual health, and is essential for childbirth. All these functions depend on a healthy internal environment, which is why overcleaning causes harm. So why do we wash the vulva but not the vagina? Because soap inside the vagina can lead to yeast infection, bacterial vaginosis, irritation, and odor. Ironically, many products marketed for freshness actually create the problems they claim to fix. Clean the outside, respect the inside. This advice alone can prevent repeat infections for many women. Here is the safest way to clean. For the vagina, do nothing. No soap, no douching, no internal washing. For the vulva, use warm water. If needed, use a mild fragrance-free cleanser. Use your hands, not sponge or loofahs, and rinse thoroughly. A healthy intimate routine is simple. Daily gentle cleansing of the vulva, breathable cotton underwear, changing out of sweaty clothes, and avoiding tight synthetic fabrics. More products don't mean better hygiene. If you've ever struggled with irritation or odor, listen closely to this part. Let's answer some common questions. Is a mild smell normal? Yes. A strong or fishy odor is not. Is discharge normal? Yes. Changes in color, texture, or smell should be checked. Should you wash during your period? Yes, but gently and more frequently if needed. Once a day is enough for the vulva. Washing too often can dry the skin and cause irritation. Listen to your body. Wipes can be used occasionally, especially when traveling. Choose alcohol-free, fragrance-free wipes. They are not a replacement for washing. In the shower, let water run gently over the vulva. Do not spray water inside the vagina. Avoid strong water pressure. Douching is not recommended. It removes healthy bacteria and increases infection risk. If you feel the need to douch, that's a sign you should see a healthcare professional, not use more products. This is why many feminine products actually make things worse. Vaginal deodorants and sprays are unnecessary. They often cause irritation and allergic reaction. A healthy vagina do not need to smell like perfume. Please seek medical advice if you notice strong or unusual odor, thick discharge, itching, burning, pain, or bleeding. As a pharmacist, I strongly advise against self-treating repeatedly without a diagnosis. If this video helped you, share with someone who needs it. Subscribe to our channel for more approved health videos like this. Remember, healthy hygiene starts with accurate information.